Hello, my friends. I'm Dr. Anna Collins, and today I want to talk with you calmly and clearly about blood pressure as we get older, because many people live with this quietly every day, not realizing how much it can affect their comfort, their energy, and the way they move through life. I want you to imagine for a moment that you and I are sitting together in a quiet exam room. There is no rush. There is no pressure. You are not doing anything wrong. You are simply here to understand your body a little better and to feel more confident about the numbers you see on a blood pressure monitor. Many people tell me they feel anxious about blood pressure. They worry about every reading. They worry they are failing if the numbers are not perfect. I want to gently reassure you right now that your body is not a test you can fail. It is a living, changing system, and especially as we age, it deserves understanding, not judgment. Blood pressure is something most adults hear about often, yet few feel truly comfortable with. You may have been told for many years that there is one ideal number everyone should aim for. You may have heard that lower is always better. You may have felt proud when your numbers went down or worried when they went up. What many people are not told clearly is that blood pressure is not the same for everyone, and it does not behave the same way at every age. As a family doctor, one of the most important parts of my job is helping people understand what their own body is telling them, rather than chasing a number that may not fit their life. As we get older, our bodies naturally change. This is not a failure. It is not something you caused. It is simply part of living. Blood vessels that were once soft and flexible slowly become a little firmer over time. The systems in the body that adjust blood pressure when you stand up or move quickly may respond more slowly than they did when you were younger. Medications may stay in the body longer and have stronger effects. All of this means that blood pressure in later life needs to be understood with more care and more patience. Many adults over 50 or 60 notice small changes that they brush off. Feeling a little lightheaded when standing up, feeling more tired than usual, needing to pause for a moment before walking after getting out of a chair. These experiences are often quietly accepted as just part of aging. Sometimes they are, but sometimes they are gentle signals from the body that blood pressure may be a little lower than what feels comfortable for you. Not dangerous, not dramatic, just uncomfortable enough to affect your confidence and your daily rhythm. Blood pressure has two numbers, and both matter, but they do not matter in the same way they did earlier in life. The top number reflects the pressure when the heart pushes blood out. The bottom number reflects the pressure when the heart relaxes and fills again. As people age, it is very common for the top number to slowly rise while the bottom number stays the same or even lowers slightly. This can be completely normal for an older adult. It does not automatically mean something is wrong. What matters most is how you feel and how your body responds throughout the day. One of the most important things I want you to hear today is that blood pressure should support your life, not limit it. It should help you feel steady when you stand, clear in your thinking, comfortable in your movements, and confident in your independence. If your blood pressure is technically perfect on paper, but you feel dizzy, weak, confused, or afraid of falling, then your body is telling you something important. That message deserves attention and respect. Many older adults tell me they are afraid to talk about symptoms because they worry they will be dismissed or told it is just age. I want you to know that how you feel matters. If you notice that standing up feels harder than it used to, or that you need to hold onto furniture for a moment, or that you feel a wave of lightheadedness that passes after a few seconds, these are experiences worth sharing with your doctor. They are not complaints, they are information. As blood pressure gets too low for an individual person, the brain may not receive quite as much blood flow as it needs in moments of change, such as standing or walking. This does not mean damage is happening. It simply means the body is struggling to adjust quickly. The result can be dizziness, fatigue, trouble concentrating, or a feeling of unsteadiness. Over time, this can quietly change how a person moves through the world. People may start walking more slowly, avoiding outings, or limiting activities out of fear of feeling faint. This shrinking of daily life can happen so gradually that people barely notice it. It is also important to understand that what feels like a good blood pressure for one person may not feel good for another, even at the same age. Two people can be 70 years old and have very different bodies, medical histories, and daily routines. One may feel energetic and strong with a lower reading. Another may feel best with a slightly higher one. This is why blood pressure should always be discussed in the context of the whole person, not just a chart. Many people ask me why blood pressure goals seem to change with age. The answer is simple and gentle. When we are younger, we are often focused on preventing problems many years in the future. As we get older, quality of life, stability, and safety become just as important as long-term prevention. A small increase in blood pressure may not cause any immediate harm, while a drop that leads to dizziness or falls can have a much larger impact on daily life. This balance shifts over time, and it is okay for goals to shift with it. Another piece of this conversation involves medications. Blood pressure medicines can be very helpful and very supportive, but they are also powerful. As the body ages, it may respond more strongly to the same dose than it did years ago. A medication that once felt just right may slowly begin to feel like too much. This does not mean the medicine is bad. It simply means the body has changed. Regular review and gentle adjustment are a normal part of good care. I often encourage people to pay attention not just to their blood pressure numbers, but to patterns. How do you feel in the morning? How do you feel when you stand up? How steady do you feel walking to the kitchen or the bathroom? Do you feel clear-headed or foggy? These everyday experiences tell us just as much as a reading on a machine. Blood pressure is meant to support your daily life, not interfere with it. Checking blood pressure at home can be very helpful for many people, especially when done calmly and without obsession. A quiet moment, sitting comfortably, breathing normally, can give a more accurate picture than a rushed reading. It can also help you and your doctor see trends over time rather than reacting to a single number. What matters most is the overall pattern and how it matches how you feel. One gentle habit that often helps is standing up slowly and giving your body a moment to adjust. Sitting on the edge of the bed before standing, taking a breath, and then rising can reduce lightheadedness. Staying well hydrated, especially as thirst signals can fade with age, may also help the body maintain comfortable pressure. Small, thoughtful routines like these can make daily life feel smoother and more secure. Movement also plays a quiet but powerful role. Gentle walking, light stretching, and regular activity support circulation and balance. You do not need to push yourself. Consistency matters more than intensity. Moving in ways that feel safe and enjoyable helps the body regulate itself more naturally over time. It is also worth saying that fear around blood pressure can sometimes cause more stress than the numbers themselves. Worrying constantly about readings can raise pressure temporarily and make people feel tense and discouraged. I encourage you to approach this topic with curiosity rather than fear. Your body is communicating with you, and together with your doctor, you can learn what it needs. Many people feel relief when they realize that there is flexibility in blood pressure goals, especially later in life. There is room for individual comfort. There is room for conversation. There is room to prioritize feeling steady, clear, and confident. This does not mean ignoring blood pressure. It means understanding it in a way that supports you as a whole person. If you have ever felt that your concerns were brushed aside, I want you to know you are not alone. Many people share that experience. Bringing a simple record of how you feel along with your readings can help guide a more meaningful discussion. You deserve care that listens to your experience, not just your numbers. I also want to gently remind you that changes should never be made suddenly or alone. Any adjustment to medication or routine should be discussed with your healthcare provider. The goal is always a steady, thoughtful approach that keeps you safe and comfortable. As we talk about blood pressure, I want you to hear something very clearly. Aging does not mean losing control. It means learning new ways to work with your body. It means adjusting expectations with kindness. It means choosing stability, comfort, and confidence over perfection. Many people find peace when they stop asking what number they should chase and start asking how they want to feel. Feeling steady on your feet, feeling clear in your thinking, feeling confident leaving the house, feeling comfortable moving through your day. These are meaningful goals. Blood pressure should support them, not take them away. Before we finish, I want to thank you for spending this quiet time with me. If this conversation helped you feel more understood or gave you something gentle to think about, I invite you to like this video. It helps others find calm, supportive information like this. If you would like more conversations focused on understanding your body with care and clarity, you may consider subscribing to the channel. And if you know someone you care about who worries about blood pressure or feels unsteady at times, sharing this video with them may offer comfort and reassurance. I would also love to hear from you in the comments if you feel comfortable sharing. You might share what blood pressure questions you have or what changes you have noticed in your body over time. This is a safe and welcoming space, and many people find comfort in knowing they are not alone. Take a slow breath with me before you go. You are doing your best. Your body is not broken. With understanding, patience, and support, you can continue to move through life with confidence and care. I look forward to sitting with you again in our next conversation.